Tacteyele, a tactile marker for medications to assist patients with low vision. Imagine a blind patient who has been prescribed 3
volume
different
बढ़ा
eye
दो.
drops. The biggest challenge? Identifying which drop to use and how many times a day. Now consider other scenarios. A patient with blurry vision who cannot read the label, or someone without assistance to help administer the drops. Studies have documented cases of inadvertent use of non-ophthalmic drops. Studies have documented times a day. Tacteyele, a tactile marker for medications to assist patients with low vision. Imagine a blind patient who has been prescribed 3 different eye drops. The biggest challenge? Identifying which drop to use and how many times a day. Now consider other scenarios. A patient with blurry vision who cannot read the label, or someone without assistance to help administer the drops. Studies have documented cases of inadvertent use of non-ophthalmic drops, highlighting this as a significant issue. How can we create an affordable, practical solution to help visually impaired patients correctly identify their eye drops and dosage? Our answer to this challenge is Tacteyele, a simple yet effective tactile marker system. We explored 3 prototypes. Bindi markers, most affordable approach, using Indian bindis, which cost just 10 rupees per set, as tactile markers on eye drop bottles. Embossed label markers, most effective approach. A label embosser, available on Amazon for just 999 rupees. It is used to create raised numeric markers by pressing a lever with the desired alphabet or symbol. The embossed strip is then attached to the eye drop bottle, providing an easy way to identify the correct dosage. 3D printed markers, customizable approach. 3D printing tactile markers and attaching them to eye drop bottles. Different shapes represent different drug categories. A triangle for antibiotics, a plus sign for lubricants, and so on, and it costs 1 rupee for a piece. Evaluating the impact. We conducted a study with 2 groups. Control group, 150 patients, used eye drops traditionally. Intervention group, 150 patients, used eye drops with a tactile marker. The results? Higher adherence rates, hence fewer missed doses. Increased ease of use, making medication management effortless. Greater confidence in self-administration, hence empowering patients to be more independent. Why tactile matters. Enhanced medication identification, reduced medication errors, improved treatment adherence, increased patient independence, minimized adverse effects. It is cost-effective, scalable solution, improved quality of life, reduced cognitive load on patients, enhanced caregiver efficiency, potential for smart healthcare integration. Conclusion: tactile markers for ophthalmic medications enhance patient safety, reduce medication errors, and promote independence among visually impaired individuals. Ultimately, this leads to better treatment adherence, increased confidence, and improved health outcomes.
This is that, no, this is that.
Tactile, a tactile marker.
Dr. Prithvi, I have a question for you.
Yes.
Why are you using someone else's voiceover? Why not yours?
You have to use your own.
Okay.
No, I want to know your logic behind using someone else's voice. It was a foreign accent.
एक presentation का pre-requirement भी है कि आपको अपना thought डालना.
No, but just tell me your logic. I just want to
No,
know your
makes it more clear. That's why.
Means you want to say our accent is not clear, or you
No,
want to say your
not-
voice is not clear?
I'm not talking about the accent. I was talking about the clarity on the voice.
You mean to say your
My-
yours
I
is
don't
not
have a good
clarity? You
recording
don't have
system.
clarity.
Maybe
That means I will not be understanding you now because you don't have clarity by the same logic.
So this
अरे
is
सर,
probably
बच्चे का
some
Wi-Fi ले
AI using.
No, my thinking is, was it prepared by someone else, or was it being used somewhere else by someone other also? Because this is a generic now. anyone can use this in any other
I
forum.
think usually, sir, you have softwares
I know.
where you have these predetermined voices, but I think it's a very novel idea, and especially we have never thought of patients who are having a low vision.
Yes.
So I think it's a very well thought
Yes, ma'am.
thing that they have a good compliance
Yes,
with the medication
Actually,
that they
this
are using.
whole idea came when a patient of mine, retina patient, he came with the he was using homemade second hourly,
Right.
and he was using Predford for BD dose. So when I asked him, he's like, it was very difficult for me to understand which drop to, and this often happens in glaucoma patients also.
Right.
So that is when I came up with an idea, why not do something, some other, sense, that is touch sense, which would be most. Otherwise, you have even the smell and even hear, but then it becomes very expensive. So the most efficient and most frugal way of doing it was through touch. So that is
Very
why
nice.
we came with this kind of an approach.
So
Where,
your clinic usually puts this and then sends out
yes,
the
ma'am.
patient?
All our post-op surgeries, we started using this, and we have found out that the patients have a very good positive feedback. Basically, because they become more independent and they know which drug to put how many times. They don't really have to ask for somebody else also. They just have to touch and they're like, this is 4 times. Can you just put
Very
it?
well thought of. Very well
Yes.
thought of.
Did you search in the literature? Has it been used? I thought that this particular method should have been used for blind people elsewhere, and there may have been reports.
So
I don't dispute that
yes,
yours
sir.
is a good technique,
Yes, sir.
cost effective,
Huh.
simple, and the requirement of this is more even with patients who cannot read the fine print despite having good
True,
vision,
true. In the literature review, what I've done,
especially for blind people.
yes, sir. So in the literature review, there is a provision where they have color coded the eye drops in AAO.
No,
So that
for-
is standardized,
no.
but again, it's not going to help with the dosage or
No,
eye
for
line.
blind people.
For blind people, yes.
For blind people, they make use of the tactile sense, the same thing.
Correct.
But I wanted to know whether this idea has been used by others also, especially for blind people with the help of braille language.
Uh-huh.
But it
Wonderful,
does not
wonderful
give-
presentation.
Thank you.
Just in lighter vein, 2 to 3 times is okay, but post-operative, immediate post-operative, sometimes we say hourly.
Yeah.
How do you mark that?
So again, we have two type of marker over here. One is the line marker, and we have the symbol marker also.
Symbol means hourly.
Symbol means we can tell them it is hourly. We sensitize them priorly while giving the drops.
Okay, we'll call the next speaker.
So
Thank
do
you
you
very
have any plans to patent this?
Not as because it's something do it yourself, so it becomes easy for everybody to do it actually. In their
So
just
make
have
it
to-
open.
That green embosser comes in the Amazon for 1,000 rupees, so that can be bought by anybody. They can start using.